Hey, it's me, Bad B, I'm back. Today I had my second Herceptin out of 17. So the first one that I had 3 weeks ago had to be done over an hour and a half, just in case I had an allergic reaction. I think it's called a loading dose. And today was a maintenance dose, so they just did it at regular speed. Well, it took 30 minutes and it went through my port. I also had the option of having an intramuscular Herceptin injection into my thigh, which would only be 5 minutes, but I'm a little afraid of pain. Apparently I can use EMLA on that too, but I have the port, may as well use it. At 9 or like 8:50 I put on some EMLA cream, rocked up at about 9. I think they finally did all the paperwork and everything like that and got me started at about 10, and I was out of there at about 10:40. Really nice. I met this lady there who also has breast cancer, and she kind of lives near me, and her daughter's a teacher, so it was just really nice. Just such a nice lady. So hopefully I see her again. I mean, I don't want to see her again, but outside of Cancerland. But yeah, from now on I can have the home-based cancer care, so they'll come to my house to do the remaining 15 Herceptin doses. So originally I had my Herceptin appointment at 9:30, and then I had my second plastics consult at 10:15. But then because they just started my infusion at about 10, I was obviously not going to make it in time. So then one of the nurses went over and talked to the plastics people for me. I got there at about 10:45, and at about 11-ish, a nurse came to get me, and she's just like, "So you're here for your second plastics appointment?" And I said yes. And then she said, "Can I just have a look at it?" So I had steri strips on my underarm where they did the incision for the sentinel lymph node biopsy, and they had fallen off. My nurse navigator, I don't know. Anyway, she told me not to rip off the steri strips and to just sort of wait for them to fall off of their own accord. So the ones on my underarm, they did. But then the ones on my nipple for my retroareolar biopsy, they didn't fall off. And then I said, "Oh, she told me not to take them off." And she said, "Don't worry. So we would rather you leave them on, so don't worry." But she ended up just peeling it off to have a look, and she said, "The incision looks really good." She said, "Okay, so one of the plastics team will be in to talk to you shortly." And it was another plastic surgery registrar. So I think there are a lot of these registrars who are young intern doctors. Anyway, so he came in, seemed nice, I guess. And he said, "Okay, I'm just going to look over your file," and just read about everything. And he said, "Who did you see?" And I said, "Dr. blah, blah, blah. Did he go through all the options with you, expanders, straight to implant?" I said, "Yes." And he said, "The tissue transfer, which is, I think, a deep flap." And I said, "Yes, well, I don't want to do a deep flap because 1, I don't want a giant scar. 2, I don't think I have enough fat to recreate what I have now. And, even though what I have isn't much, I don't want them to be smaller." And he said, "Fair enough. So do you know who will be doing your surgery? Because in the public system, you can't choose. It's just whoever's around," which is totally fine. And I said, "No, it wasn't Dr. blah, 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 who I saw last time. It's going to be another doctor." And I said, "That's fine." He said, "Okay, so she'll probably be in to look at you. She'll probably ask you the same questions that I did because you haven't met her before." And I said, "Yeah, that's fine." And he said, "Do you know which breast surgeon will be operating on you?" I said, "No." So he called up the elective surgery. Even though it's cancer, it's elective surgery. Well, it's under elective surgery. Anyway, he called up the hotline lady who, oh my God, I had been waiting for a surgery date for ages, and it was just giving me so much anxiety not knowing. But then I got a message from an automated number on Friday afternoon, but I was charging my phone and it was on low power mode, but also I think my phone thought the message was spam, and so it didn't notify me of this message, and I got it about 2:45 or something like that. Anyway, I finally see the message and it says, "Please call back elective surgery as soon as possible." And then I was like, oh shit. I called back. It was past 5 o'clock, so on a Friday. So no one was there to answer, and I just left a message. And they said, "This hotline is manned Tuesday to Friday, 8:30 to 5. And I was just thinking, oh my God, I'm going to be anxious about it all weekend. Monday comes. I thought, I know it's not manned on Monday, but I might as well just try and call. Yeah, it wasn't manned. Tuesday from 8:30, I called and it went straight to voicemail. I called 9 times from 8:30 to about 9:40 trying to get through, and it goes to voicemail, straight to voicemail every time until I think the 8th ring. It rang out for ages and then it went to voicemail. The 9th ring, she finally picked up and I said, "Oh, hey, it's Bad B." And she said, "Yay, I've been trying to get in contact with you for ages." And I said, "Well, I've been trying to." Anyway, so he called her and he said, "It won't be the doctor who did my sentinel lymph node biopsy. It'll be the guy that was supposed to do it but wasn't doing it." Anyway, so he's my breast surgeon. I haven't met him yet either. And then other plastics lady who, I had a Google of it and she has really good credentials. So he left and he said, "Can you go onto the bed and take off your shirt?" And I said, "Yeah, that's fine." He said, "I'll get you a gown." And I said, "Yeah, that's fine." He said, "Well, I'll go chase up Dr. Blah Blah. She's pretty busy, so it might be a wait." And I said, "That's fine." So I'm in my gown and it was weird just kind of sitting behind the curtain when no one was around. So I just went and looked at my phone. So the plastic surgeon, the surgical registrar, and then my nurse practitioner navigator came back in and she discussed, "Okay, so are you aware of all the options? What's your cup size?" And I said, "Well, I thought it was a C, but apparently it's a B according to previous plastic surgeon." And she said, "Okay, so we won't be able to give you bigger boobs. It'll probably be the same size or a bit smaller." And I said, "Okay, at least I'll be cancer free." And she said, "Okay, so when we do it, I'm going to make an incision parallel with your nipple and then a little bit under, and then obviously under your boob." And I said, "Okay." She's like, the breast surgeon will come in and take out all the breast tissue and then you'll be left with skin, and then we'll undo the muscle from the bone, the pectoral muscle, put the implant up there, but then at the bottom, because you won't have enough skin, it might just kind of like sag or fall out." And I said, "Oh my God, I don't want that." And she said, "Well, there's two options. You can have either, what does she call it? Artificial dermis." Yes, I was like, "Oh, fake skin." And she said, "Yeah, first one is a titanium mesh that will go in and then your tissue will grow around it." And I said, "Oh, okay, cool." And she said the other option, she said, it's donated skin." And I said, "Oh, okay." From a cadaver. I said, "Okay, which one do you think is better?" She said, "Oh, they're both good." And I said, "Okay." And she said, "Well, when we do donated skin, they have to reconnect the blood vessels and then there's a chance that it could get rejected and like the blood vessels won't be able to go through or something like that." And I said, "Oh, okay, that sounds really, I don't want that. I think I'm just going to go with the titanium mesh." But then I said, "Okay, I have a bit of a stupid question. What happens when I go through airport security?" And she's like, nothing will happen." And I was like, "Okay, sorry, it was dumb." And she's like, "No, don't worry about it." Anyway, so she was really nice. I have my surgery next Friday, so a week and a day. Yay. Well, I have to be there at 6 a.m. have to fast from midnight the night before. So glad I have a date. So it makes things so much easier. This is just kind of the last frontier.
4 to 6 days later.
The surgical registrar gave me a blood test slip for pre-surgery bloods, which I did while I was there. And yesterday I was at work and they called like 3 times, left 3 messages. The first one seemed to just be like a butt dial, so I could just hear talking in the background and swooshing. And then they were like, "Oh, please call us back. You were supposed to get pre-surgery bloods. Yeah, call us back ASAP." So I called them back when I finally got out of school. The nurse said, "Did you get the double-page blood slip from your pre-admission consult?" And I said, "Well, I had a pre-admission appointment before my sentinel lymph node biopsy, but I haven't had one for this DMX/reconstruction." And the woman who books the surgery said that I wouldn't need one. And she said, "Oh, okay." And I said, "Also, I got bloods on Thursday when I was at the hospital." And she said, "Oh, was it double page?" And I said, "No, I just took the one slip that the surgeon/surgical registrar gave me. But apparently it was the wrong one. So now I have to go back on Monday to get bloods for my Friday DMX, and I hope I have enough time." Yeah, you can still see it's kind of a little bit bruised. And this is the arm that has the better veins, but I had my sentinel lymph node biopsy and retroareolar biopsy on that side. I don't know, I guess we'll see how it goes, because they can't do it from the port. You have to be specially trained to take blood from the port. And I went to chemo and I said, "Can you take my bloods from here?" And they said, "Oh, we don't really do that." I've had it done there before. Whatever. Anyway, also, so I've had 2 out of 17 Herceptins in Australia, but I had Herceptin 4 times in Japan with Pajita while I was on Taxol. And I got chemo acne once on Taxol. I got chemo acne once on AC, and now I think I'm getting it again on the Herceptin, but I was given doxycycline when it happened with the AC. But I don't know if I'm allowed to take antibiotics before surgery. And it's a Saturday. I can't call a doctor until Monday to find out, and I'll be there anyway getting my bloods. But it's just super frustrating, super annoying. I'm pretty nervous / excited for my surgery on Friday. I just want to get it over with. I'm just so over it. And it's kind of the last frontier, I guess, aside from the scary Zoladex injections. Apparently they're fine. I don't know if people are just saying that because they know how needle phobic I am. I don't know, we'll see. Stay tuned. Oh, also, second set of press-ons. I also got these from Etsy. They were longer, but I filed them down. Super cute. Also, because I wear contact lenses, I have trouble putting them in when my nails are long, but I got a little tiny set of tweezers and plunger thing to put contacts in and take them out without using my actual fingers. And it seems to be going well so far. Went back to the eyebrow stamp because I feel like the pencil was just too dark.
4 to 6 days later.
I just got back from my second set of pre-surgery bloods. I went to the pre-admission clinic, like the window, to tell them that, you know, someone called me on Friday saying, why didn't I get bloods? And that I had to do it again today, and there would be a referral, like a blood slip waiting for me there. I get it. They've spelt my name wrong. Guess it. I should be used to it by now because I don't have a Western name. Yeah, I got there. There were 2 people ahead of me, got my bloods, and she's like, oh, you're back. And I said, yeah. Apparently I didn't do enough bloods or they were the wrong ones. And she said, oh, they didn't say group and hold. And I said, oh, what does that mean? And she said, before surgery, they have to get a sample of your blood and like hold it just in case you need a transfusion. And the paper I had to sign said, are you pregnant? Obviously not. And have you had a blood transfusion? Clearly haven't. I guess it's not clear, but I haven't. So yeah, hopefully this is the last set of pre-surgery bloods. Anyway, yeah, there we go. Exact same place as last time. My good arm, my good veins. I drank heaps of water. I had a cup of water, a giant cup of coffee, and then a smoothie, and then another cup of water. Fingers crossed it's all good. I've been super hay fevery this past weekend because it's just been super windy. My eyes are super itchy, had a runny nose, and I've been sneezy. Ugh, I was really paranoid waiting for the blood test because I thought, well, I'm really paranoid, but I'm Asian and I'm sneezing. What if they think I've got COVID or something? I saw this meme a while ago and I was just like, crime, sneezing while Asian at the height of the pandemic. But yeah, anyway, I've still got that mentality, really afraid to sneeze. But yeah, so let's see how things go before surgery on Friday. Stay tuned.